Good afternoon, everybody. Thank you very much for coming along to our second webinar in the patient feedback webinar series. You may have been expecting to see my colleague Stacey Clift, but she's unable to take part today, and so I'm actually deputising for Stacey. And my name is Rachel Heatley, and I'm a Senior Research and Policy Officer at the General Osteopathic Council. And I am very ably supported behind the scenes by my colleague Stacey Towell, who you can submit questions to in case you're having any IT difficulties joining the webinar. We are due to have quite a few more people joining, so it may be, yeah, I see one or two more. So I think I'll just have to crack on because I know so many of you are probably doing this on your lunch break. So let me move forward. So I just wanted to say to you that today's webinar, what we're going to cover, I wanted to do some housekeeping and just to say, due to the number of attendees, we're expecting 40 or 50, all mics are off and cameras are off as well. But you can submit questions via the question section of the control panel. And we're going to have a Q&A at the end. We may not have time to answer every question, but we will follow up with an email if we don't get to answer your question. Or if at the end of the session you think on reflection, or you're looking at some of the info that we discussed, you can contact us, and I've included Stacey's email there and mine as well. And lastly, we're going to be doing some polls, some live polls during the webinar. Don't worry, when the polls are live, you won't be able to see the PowerPoint presentation, but that will only be momentary. Once the polls are closed, the slides will reappear. And I'm going to be sharing all the materials discussed today in the webinar, along with the slides. So you don't need to take notes if you don't want to, okay? If you're unfamiliar with GoToWebinar, this is what your control panel will look like depending on the device that you're using. So on the left-hand side, say for example, you're using a Samsung phone, that's what it should look like. If you're using an iPhone, the middle image is what your screen should look like. And if you're using a PC or a laptop, this is what your control panel will look like, okay? Now, what will I cover today? Well, I'll explore how you can undertake a simple analysis of the results you've got from your patient feedback surveys. Then we can explore ways that you can record and reflect on those results. And once you complete that process, then that means that you have met your objective activity requirement for your CPD cycle. And you only need to do one objective activity in your 3-year cycle. And then lastly, this is about considering how you can apply this learning in practice. Now, for those of you who perhaps didn't get to attend the last session, what we went through were the different ways that you could obtain feedback. We shared quite a few of the template surveys that we've produced, and we discussed the different methods, so whether you would opt for online or hard copy. And ahead of this session, we agreed to think about the areas of your practice that you'd like feedback on, review the example patient survey templates that we shared. So pick a survey template, or perhaps once you went through the templates, you thought, no, actually, I'd like to create my own questionnaire. And then decide how you would administer your survey. So that would be hard copy or online. In addition, then, there was a need to prepare a patient information sheet to accompany your survey, so your patients knew why you were asking them these questions and what you were going to do with the responses you got back. Prepare a method of administration, so that could have been a box in reception where patients could drop in their submitted or their completed surveys. And then if you're in a large practice, we recommended involving other members of staff, so receptionists or health professionals. Now, in the in the previous webinar, we asked two main questions. So the first one was, which method of patient feedback are you going to use? And the majority of people who participated said hard copy questionnaire. and those 15 responded and said not yet decided. So I'm going to ask you the question again today, just to get a sense of what worked best for you, what you decided to choose. Again, we asked which patient feedback survey did you think you were going to use? So the 5 options you can see there, and the vast majority of you said that you were going to use the care measure template. So I'm going to launch the poll now. Bear with me one moment. Hopefully the technical difficulties won't arise, but there, I'm launching the poll and hopefully that will appear on your screen. And the question is, which method of patient feedback did you or are you going to use? So hard copy, online survey, or other. So I see some answers coming in, which is great. Thank you very much for participating. I'm going to give it another moment or two. Yep. Okay, and I'm going to close that poll in a moment. Okay, 84% of you have voted. Okay, that's great. All right, thank you. And I'm going to share those results with you now. So you can see, yep, that the vast majority, no, actually, it's a fairly even split, 56% hard copy, 44%. Okay, that's interesting. That's slightly different to other polls that we've done. Okay, that's great. And I'm just going to move to the next poll. So which survey template did you use? I'm really interested to hear your answers to this question now, because we're trying to decide if we need to do more work on certain surveys. So I'm going to launch the poll now. Which template did you use? So I'm going to launch it, and hopefully that should appear on your screen. And the 5 options are the GOSC survey, the care measure, the NCOR survey, the National Voices survey, and the impact of COVID-19 survey. Okay. All right. Quite a few of you are responding now. I'm just going to take a moment or two longer to give you all a chance to vote. Okay, 70% of you. Okay, all right. I'm going to thank you very much for participating. I'm going to close that poll now. And I'm going to share those results with you. Okay, so you can see, okay, yep, the similar trends. So the vast majority are used the care measure survey, which I did kind of anticipate potentially. 21% the GOSC survey, and nobody used the National Voices, and 7% NCOR, 7% the impact of COVID-19. Okay, that's interesting. So things did change whenever you looked through the templates and what they entailed. Okay, that's great. Thank you very much. I'm going to turn that off now. So the focus today. So that's what we're going to look at are two ways that you can analyze your results. So we have produced a series of Excel templates that you can use to help you analyze your results. Just to say, some of you may not be comfortable using Excel. That's completely okay. It took me quite a while to get used to it, and there is no obligation to use it. I'm also going to be showing you a simple way to just use pen and paper and to tally up your results. I want to I'll probably say this a couple of times, and sorry if I kind of bore you with it. I don't mean to. The important thing is not about the using Excel or tallying your results or the analysis per se. What's the most important thing for you is to get a response that you can reflect on and then implement some learning in your practice, okay? So I'm going to take you to the first one. So if you've used the GOSC Excel template, the aim of the templates is to total up your responses to each question. And here we have an example of the GOSC template. And the templates we have produced allow you to input your results, and then a bar chart will automatically be generated to help you identify your strengths and areas for development. So perhaps on first glance at this, you're thinking, this looks a bit complex, but they're just a tool to enable you to process your responses. It's not compulsory, but it's been tried and tested. with a lot of groups that we have worked with who have found it useful. So I'm going to show you all 5 templates, but this one in particular is the GOSC one. But each template has on the left-hand side a table. And on the very first column here, all the questions are listed. So you don't need to type anything into any of those kind of columns with the questions. They're already pre-populated. What you need to do, and let me give you an example. If, say, you sent out 20 questionnaires and you got 15 back, well then in this box you would put in 5 didn't respond. Out of those 15 who did respond, 9 said you did this very well. So you were really good at asking about why the patient attended. 4 said fairly well, and 2 said not very well. And then what happens is when you add in those numbers, what will happen is a bar chart is automatically generated. And so you can see the colored tabs here. And this osteopath, as I said, did a particularly good job about asking patients why they attended. And we've got instructions on each of the templates. So, and we've given you an example of how to do that. So all you need to do is input the numbers. You don't need to change anything else. And that's what we've created for you. So once you put the numbers in, the bar chart will automatically update. Now, this can be a really useful way of identifying your trends. So say, for example, one of the areas had more numbers in the not very well. Say out of the 15 responses you got, 9 said not very well. Well, you would be able to identify that very clearly on the bar chart. And then this is a very kind of succinct way. You can copy and paste this bar chart and put it into your recording and reflecting sheet. So you're looking through how I did, and this is a simple visual way that you can demonstrate your results, okay? So most of you have undertaken a survey using the CARE measure, and this is what a completed template looks like. So on the left-hand side, all the numbers are in the table, and then this bar chart is populated. So you can see that very good purple. This osteopath is very good at fully understanding the concerns that the patient had. There were very few did not respond, in fact, 0. So, very engaged patients. One of the areas that perhaps the osteopath needs to develop is making a plan of action with their patient. So the kind of post-treatment is perhaps an area that they would want to focus on. Again, we've got the NCOR Excel template. This is obviously the easiest one. All you have to do is add up the results and then input them. So was the patient able to ask questions? 1 said yes, no said, 9 said no. But again, it will populate. And contact details are included in each Excel spreadsheet, so you can reach out if you have any queries. Additionally, if any of you did change the questions or add the questions, you can change the text there if you want to, but equally, if you're not confident doing that, I'd be happy to talk through it with you individually. So nobody used the national voices, so I'll not focus on that. I'll give a little bit more time then, excuse me, to the impact of COVID-19 Excel template. So the impact of COVID-19 had 4 sections: questions on pre-treatment, questions on treatment 1, questions on treatment 2, and then questions on aftercare. And so there were kind of yes, no questions on that. And then qualitative, what we mean is open questions. So how good was the osteopath at making you feel relaxed? And then how did you think about this? What were your thoughts on this? And then you can add in your own text. So each tab corresponds to sections of the survey template. So pre-treatment, treatment 1. And then you use those tabs and sections which apply to you and your patient feedback survey. So if you only chose to kind of use the part of the survey that was focused on pre-treatment, then that's the only bit you need to look at. So I know this is a little bit small, but I can take you through it. But to make it easier, the fields marked in yellow need to be completed for a graph to be populated on each of the Excel tabs. So you can go through, everything's highlighted, and again, it will generate this results tab, okay, this results. Now, many of you might be saying, I absolutely do not want to use an Excel spreadsheet, and that is absolutely okay. One way that you can do it, obviously I've put this in a table, but what I'm saying is you can do this with pen and paper. So you have your stack of surveys that you've taken from the post box in your reception, and you count them all. And so what I would recommend doing is going through each question. And what this osteopath has chosen to do is to identify where they have scored very well in with survey responses from patients. So for example, they asked, how thoroughly did the osteopath listen to what you had to say? And they got 10 surveys back, and out of those 10 surveys, all the patients said the osteopath did that very well. So that's a strength. So that's the analysis. That's all you need to write is a strength. It's based on the numbers. So if you got 50 surveys back and 40 of those said you scored very well, well then that's clearly a strength. However, if you look down at the bottom, it says, how well did the osteopath show concern for you? Out of all the responses, only 4 out of the 10 patients said very well. And so this is clearly an area for development. So it's as simple as that. Write all your questions on the left-hand side of the page, identify how many patients said you did something very well, and then you're able to say, based on that number, it's a strength, it's maybe neutral. So say, for example, the frequency was 6. So 6 patients said you scored very well. So that's kind of somewhere in the more neutral territory. And if only 2 patients said you did very well, then that's an area for development. So that's a simple way to do it. And it may be that you feel more confident with that approach. And if that is the case, that's no problem at all. Now, the more complicated side of things, quite a few of you can see, as I said, used the CARE measure, but others used survey templates that involved open questions with text boxes that patients could write their own answers to. So for example, what did you like about your osteopathy appointment? Well, I particularly liked the way the osteopath sent me pre-information, particularly in regards to COVID and the measures that they had implemented. So you can, they've written a little bit of detail there. What I would say is initially, first of all, read through a couple of your responses just to get a sense of what your patients are saying. And one of the easy ways to do that is look at the most common words to start. And then what we do in the General Osteopathic Council, so we ask a lot of, we kind of conduct a lot of feedback surveys. That's with osteopaths like yourselves, or that's with patients, because we want to get a sense of how things are going in terms of what we're doing. And the simplest way that we analyze the comments are to have 3 categories: positive, negative, neutral. And so you can see easily with the language what comments fall into what category. Now, we are very much on trying to get richer insight into the feedback that you give us. And if you wanted richer detail, you could create subcategories underneath your general ones. So that could be about the administration, that could, for example, how the patient felt booking an appointment. Was that process easy? Did they find the information useful that you sent them pre-treatment? And as you move along and divide the responses, positive, negative, neutral, you might see some of those reoccurring themes. But what I would say is, so you go along, you put them into the bucket of positive, negative, neutral. Then once you've kind of done that roughly, you can double check and recategorize as you go. When you're doing it, these are kind of 2 of the questions that you could ask yourselves. So, are the comments one-off or supported more than once? if you get a particularly negative comment, so we held a smaller scale webinar and one of the osteopaths got a really negative comment and was a bit taken aback by it, but they looked into it and it was a complete outlier. It wasn't supported by any of the other comments, and they realized that that patient actually was providing feedback about a completely different service that wasn't related to the osteopath. So she was able to breathe a sigh of relief. That comment wasn't reflective of her practice. And that may have been the case for you as well if you're getting a range of comments. How do you connect two comments using different language making the same point? So if I was your patient, I could say the osteopath was really empathetic. And another patient could say, you were really lovely and felt like you really got what they needed. So they're pretty much the same thing, and you would put it under the positive. But you could also then have a subcategory about showing empathy or concern for the patient. Okay, so that's what I mean in terms of the positive and then the subcategories, or sorry, the top line categories and then the subcategories. One of the things that actually might be really useful to you is discussing the comments with another colleague to gain a different perspective and to explore different insights into your results. So a lot of osteopaths have actually discussed it with their patients, or sorry, with their receptionists, for example, or administrative staff. And that has provided a really useful opportunity for reflection. And that could be that the booking system isn't easy to use, that the osteopath may never have asked that question, and those two worlds were almost separate, what the clinical treatment was versus what the kind of administration side of things. And it would have been then a useful reflection on the patient's experience that could then inform what the receptionist does. Okay, so it is really useful to have those discussions if you feel comfortable doing so, but it's good to get that richer insight. So I just wanted to take you through, as I said, we do an awful lot of surveys and we ask a lot of detailed questions, and we're very much interested in the comments. And we did that recently with the CPD survey, the CPD evaluation survey, which perhaps you took part in. And one of the questions we asked was, during your last 12 months, have you made any changes to the ways in which you practice as a result of comments made to you by a patient? So out of the hundreds of osteopaths who answered this question, 34% said yes. And each of those then added a comment. And so we're going to look now at the types of changes that osteopaths implemented as a direct result of patient feedback. Now, we're talking numbers here. So we got 118 comments, which, as you can imagine, it could have been easy just to say positive, negative, neutral, but we wanted that extra level of information and what osteopaths actually did, what the actions they took were. So we got the most amount of comments, so 28, about communication and consent. And an example comment that we wanted to share with you today is that this osteopath, in relation to direct feedback, said, I put an emphasis on explaining what is going to happen next in every consultation and continually reminding patients to ask questions about their treatment and treatment plan. In our survey, we asked specifically about COVID-19 and some of the changes that osteopaths made in relation, or how COVID-19 impacted their practice. So that became a theme this year that obviously we wouldn't have asked in our 2019 survey. So 13 osteopaths submitted comments, and we just took a sample comment that said increased sensitivity regarding patients' COVID concerns. And then we also had comments, 13 comments about changes to bookings and appointment structure. And one osteopath said, I try to run more to time now. Okay, so that is page number 1 of the comments. And I hope you can see that we do spend a lot of time, we do listen to you. Again, there were 118 comments, and these are some of the further subcategories. So there was one about aftercare, there was one about changes made to documentation, and one of the osteopaths said he has changed his initial information sheet sent to patients to include more information on attendance at the clinic. And then implementation of a patient feedback tool. So 3 osteopaths told us that this is what they've done, and they've now developed a patient feedback form. One of the things I would say, just to reassure you, is that sometimes comments can't be categorized under a specific category, and that's okay. So we actually always include a category that says other. So if a patient expresses that they do or don't like any aspect of their visit to the clinic, I try to tailor to their needs. For us, that didn't fit into any of the categories, so we just put it in other. Now, I'm conscious that I've kind of put a lot of information on you there, and it might be a little bit overwhelming. Perhaps it might feel better after you've read the slides, had a play around with, say, the Excel spreadsheet, or started to tally up your responses. And then once you try that, you may want to come back to me or Stacey and say, actually, I didn't get this, or perhaps for whatever reason, the bar chart isn't populating in the way that I thought. It's no problem to come back to us and get some additional support. All right. So based on what I've just said, I'm going to launch our final poll, and I'm hopeful that we'll get some positive results. What I will say is, if you don't worry, you can come back to us. Okay, so I'm going to launch this poll now. Bear with me. So I'm launching it now, and that should come up. So how do you feel about analysing your patient feedback? Very confident, confident, neither confident or unconfident, unconfident, and very unconfident. Sorry, I have a bit of a dry mouth right now, so bear with me. Stacey is the expert in this, and I'm trying to do her justice, so bear with me. Okay, I'm going to close that poll now. I think the vast majority of you have responded. Okay, so I'm closing it now. I'm going to share those results with you. All right, you can see. Oh, okay. Well, I feel a lot better about my presentation now. That's awesome. Thank you. So 22% of you are saying very confident, which is fantastic. 50% confident, 20% are feeling fairly neutral about the process. Okay, and the 6% of you that are feeling unconfident, don't worry, I'm here to support you, as is Stacey. So you can contact me directly afterwards, and I'm happy to take you through it one-on-one, looking at your results and helping you maybe populate an Excel spreadsheet, or giving you an example of how you could tally the results. Okay, so I hope that's a wee bit more reassuring. All right, so I'm going to hide this poll now. Okay, so hopefully you can see the slides again. Now, recording and reflecting, that's the key, really. Reflecting especially on what you've learned, on what you will do differently as a result of the patient feedback. It may be, and this is definitely the case with some of the smaller scale webinars, a lot of osteopaths feel much more reassured that they're doing a good job, and that the vast majority of the response that they've got has been positive. And that's okay. You know, it didn't have to be that you got something extremely negative. It could just be that you're doing an excellent job, and hopefully this has provided you with reassurance. The key is, in order for this to count as an objective activity and meet that requirement of the CPD scheme, we have produced a patient feedback analysis template. Now, it's a bit small here, but I'm going to go through it in more detail. What we've included in that template is a completed example. So you can see that we're not looking for tons of information. This is for your benefit, not for us. This is about what you've got out of getting this external feedback. Okay, so what I will say is, when you're recording your objective activity, when you're recording your patient feedback, And there's no obligation on you to use that template I just showed you. But these are the things that we would suggest you consider. Okay, so your aim. Why did you collect feedback about your practice? Was there a particular area of practice that you were interested in? What did you want to find out? Did you want to find out if you were doing a good job? Did you want, that reassurance, or was there something that you were particularly worried about and wanted to double check that you were doing okay in that area? Then method. How did the survey that you chose answer your aim? So it may have been that you were concerned about the impact of COVID-19 on your patients and their views about your practice. So with that in mind, I would envisage that you chose the impact of COVID-19 survey. How did you select your sample? Well, did you run your survey over the period of 3 weeks, and did maybe you only survey all new patients? That's okay if that's what you chose to do, but that's maybe what you were particularly interested in. The analysis. So what were your areas of strength? What were your areas of development? And as a result of that, what next? What can you do to build on those strengths? And what can you do to develop those areas that maybe you didn't score as well? And what would you do differently next time? So I'm going to take you through a completed example of the template now. And this is an osteopath who has who chose patient feedback because they just wanted a general overview of their practice and wanted feedback on how they could perhaps improve their patient care. So what did this osteopath do? Well, he saw around 100 new and existing patients per month, and that was a variety of new and existing patients ranging from 18 to 80 each week. And so he decided to give out his patient questionnaire to all patients seen in a week. And in addition to that, so we worked with this patient, he realized because his age group was 18 to 80, he decided to do both a hard copy questionnaire and an online survey. So and he offered patients a choice. So many of the older patients weren't au fait with answering an online survey and preferred to complete a hard copy. And so that was an interesting reflection in itself. That was already a change to thinking about the patient perspective. So he used one of our Excel spreadsheet templates, and in his actual, record of what he did, he just copied and pasted the bar chart that he was able to generate. And it was easy for us to kind of see. He asked for our support on it. So what were his areas of strength? Well, he felt really pleased after he got his results because it was predominantly strengths. So how thoroughly he asked about why the patient had attended. He was very strong in listening to what the patient had to say. He was very strong in putting the patient at ease during their physical assessment and examination, and he was very good at explaining the patient's problem. So he conducted a survey that had both closed questions, so very well, good, not very good, fair, but he also then had questions that were open questions, so allowed the patients to give a little bit more detail. And looking at that, he was able to see that in 2 of the questionnaires, patients who were coming on Tuesdays, those scores were kind of slightly lower, and there were a few kind of comments about engaging the patient in the consultation and demonstrating concern for their welfare. So what did that mean? Well, he was really pleased with the results, that he obviously was, had a very good approach to so many areas of his practice. What he was less good about, and what he realized the issue was, that appointments on Tuesdays were quite compressed. He had one after the other, and the reason that he had done that was that he had a long-standing appointment on a Tuesday night, so he didn't have as much time between patients, and he felt very rushed. And so what he did as a result of the feedback was have one less patient in that afternoon, so that he was able to have a little bit more space between patients. He felt less rushed, and so he could engage the patient in the consultation. He was less stressed, and as a result, able to demonstrate concern for the patient's welfare. He found the survey useful, but he wanted to do it again. He said he would do it in his next cycle because he wanted to see if there was consistency. Upon reflection, what he has decided is not to do the patient survey again. What he actually wanted to do was peer observation. So he's got this feedback from his patients about his practice, but he wanted then to talk, have a colleague come in and watch him while he treated a patient. Okay, so he wanted to try something slightly different. So that's fine. That's absolutely no problem at all. I want to give you some reassurance. There's no right or wrong in any of this at all. This is about what the results were for you. What was the output that you got? We don't want you to show us all of your results. This isn't for us at all. This is for you to get external feedback on your practice. And actually, even undertaking this, if you got all positive answers, for example, perhaps if you felt a bit disappointed, you thought, well, there wasn't much point in me doing this if it's all positive. Perhaps if you did it again next time, you might do it differently. It might be that you only used a survey that had yes or no answers. Maybe next time you do it, you might get a bit of richer detail. You might get a bit more information on pre-treatment, on action plans. It might be that you're particularly interested, say, for example, some of the osteopaths we have spoken to have a lot of new patients as a result of the fact that they haven't been able to get treatment in the NHS and they're turning to other health professionals to get that treatment that they need. And it may be that you then next year wanted to give feedback to only your new patients to get a sense of how you can compare and contrast. Okay, I want to say that we are absolutely not looking for expert analysis, not at all. It is not a research project. It is not a thesis. Please don't feel overwhelmed. To the 6% of you who said that you feel very unconfident about analysing your results, don't worry. It's just about trying to identify trends, getting some useful information that you kind of find insightful. It's to enable you to consider what your patients think about your practice and how you can make it even better. And bringing other colleagues into that can be so helpful as well. I would say that that is one of the most helpful things to help, get you a sense of how you can reflect on it. Maybe the survey process didn't go well. Maybe you didn't get the number of surveys back that you thought. That is totally understandable at times. I spoke to an osteopath the other day who was disappointed in the number of responses that he received. And so he and I had a chat through, and he shared with me the survey that he shared, and he shared his patient information form. And one of the things that was missing on his patient information form was about data privacy or data protection. And perhaps on reflection, he realized that some of his patients, if they didn't have that information and didn't have that confirmation that their feedback would be anonymous, that it would be protected, that they would have data privacy, perhaps that put some of his patients off in responding. So have a think about that. Happy to chat through. And if you wanted to share with me, if you created your own questionnaire, for example, or you didn't get as many results as you'd hoped, I'm happy to chat through that with you. And what I'll also say is the skill of exploring patient feedback is a CPD in its own right. Whatever time you invested in this process, that is all CPD. Every kind of half an hour, or if you read through the templates, if you read the patient feedback workbook, if you watched our previous webinar, I have no doubt that that took a lot of time. Some osteopaths said that took them 6 hours. All of that is CPD. So next steps. I'm doing this very quickly. I realise hopefully that's not a bad thing for you and it leaves a bit more time for questions. What are your next steps? Well, it's about completing your analysis using either the Excel template or pen and paper to display your results. I will provide you with the recording and reflecting template that I just went through, and that has the completed example to help give you a little bit more guidance. Now, at a recent webinar that we did, lots of osteopaths had initially decided that they wanted to do patient feedback, that they wanted to do a survey, but they realized that they weren't confident with it and it would perhaps be more work than they were willing to input, which I can understand. So what they did was they attended the webinar, they got insight from it and from the learning of others, and decided, no, in their next CPD cycle, they'd do patient feedback. But this time round, they wanted to do case-based discussion because it was something that they'd done informally anyway, and it was something they were more comfortable with, okay? So that's no problem if you kind of have got halfway through this process and said, no, it's not for me. I've taken what I've learned from it, but I'm not gonna go through the next half of it with analysis of your results. That's no problem. So we have a case-based discussion live webinar, and that's taking place on Thursday, the 24th of June from 1 to 2 p.m. And I've included the registration link there. Now, obviously, we've got quite a few resources, and you can find them all on our CPD site, and we're adding lots of stuff, you know, all the time to help you. What we've taken osteopathic, you know, feedback from osteopaths who have said completed examples are the things that they find most useful. So we're working behind the scenes to create more of those templates so that you have that guidance and support. Now, we have a lot of resources about planning your CPD, and maybe, you know, you've found this CPD cycle, it's a new cycle, you've maybe struggled to get to grips with it, but you're coming to the end of it, you've got all the stuff done, but the next 3-year cycle, you're thinking, oh, I don't know how I'm going to approach it, I want to do it differently. We've got dedicated resources about planning your CPD. If you choose next time round perhaps to do peer observation, we've got objective activity workbooks to support with that, to support with case-based discussion. Peer observation, and I should know the other one. Oh, patient feedback, what we've done today. Then communication and consent. Lots of osteopaths seem to be very concerned about this area. So we've got a workbook based on communication and consent. One of the things I would say is try not to feel overwhelmed by that. We're kind of suggesting or recommending that you spend about 3 hours undertaking a communication and consent activity. And that should entail looking at theme A of the OPS, communication and patient partnership. So you should take some time to read through that. And then perhaps you want to read through some of the NCOR resources. They've actually got great resources on communication and consent. What I will add on that is that so many of the CPD activities you undertake are likely to have a kind of communication and consent aspect. So try not to worry about that. And then keeping CPD records, we have a whole host of templates, which I've talked you through. One, we have a whole plethora of them depending on the activities you undertake. So you can have a look at that. I have obviously talked through a great deal of resources today. We have them all in one place to make it easier so that you don't have to go searching for them. So the link is there, and my colleague Stacey has very kindly shared that link in the chat box as well. So we've got all the templates we discussed. We've got an example patient participation information form. We've got all the Excel spreadsheets to match all the surveys. And we've got a patient feedback analysis template. So that's like to help you record your objective activity and to reflect on it. Now, once you have completed your patient feedback, you've filled in your form, you will be able to complete an aspect of your peer discussion review template. you'll have ticked off standard 2. You may want to then, I don't know how many of you have engaged in the peer discussion review process. We have produced a webinar that my colleague Stacey Clift and the Chief Executive, excuse me, Matthew Redford delivered, and I've got the link there on the YouTube video. One of the things I would say is that lots of people think you have to leave your peer discussion review to the end of your 3-year cycle. That is not the case. You can actually do it on a piecemeal basis, and having completed your objective activity, and if you already have a peer, you may want to complete standard 2 of your peer discussion review template. So hopefully that's reassuring. You can get it done out of the way, and that's one of the biggest pieces of work for the peer discussion review. So you can find out a bit more and watch the webinar on the YouTube link. So I just wanted to say I've done that in record time. I'm conscious of that. Stacey Clift, as I said, is the expert, but hopefully you find that useful, and you can obviously contact us at any point. You have both of our email addresses there. And now I'm going to open the floor for questions, and my colleague Stacey Tile is very kindly going to hopefully you see that. Yep.
Hello.
Stacey Tile. Oh, hi Stacey. Have we any questions?
We have a couple of questions, yes, just the 2 actually, both very similar in what they're sort of asking. So what I'll do is I'll combine them, Rachel, for you. Yeah, so it was all around sort of responses and how many is meaningful. So is it better to limit questions to a set time or for 1 month, or like a numeric sort of first 40 replies? So how many responses in total should make it a meaningful exercise?
Okay, yep, no problem at all. If you're not getting the responses the number of responses that you'd hoped for, not a problem to extend out the period of time that you are conducting the survey over. What I would say is consider how many surveys that you've put out, consider how many patients that you've asked. In our mind, what we've been seeing is an average of about 30. And that's been able, osteopaths who are getting those numbers have been able to identify trends. So if you're not getting the numbers that you expect, take a step back and think, is it that I'm only handing out hard copy surveys? Would the patients that I treat prefer to complete something online? For example, me, I complete everything online. If you send me paper, I wouldn't even know where it is, So it may be that you want to reflect on how you administer your survey. It may be that you want to look at the questions, but it is no problem at all to extend the survey out for a longer period of time. That wouldn't be a problem at all. But look at how you administer the survey. Are you giving patients it by hard copy? Are you doing it online? One osteopath realized that because of COVID, the patient didn't want to go in and fill in the survey and send it and then kind of drop it in the box. They just wanted to kind of leave fairly quickly. So he wasn't getting the numbers that he expected. So midway through seeking patient feedback, he actually changed it and started to give his patients a self-addressed envelope so that they could just post it back. So give yourself the time. If you want to talk it through with me, it may be that I see something that you don't, or because we've worked with a lot of osteopaths, and I'm more than helpful. I am more than helpful, I hope, but I am more than happy to talk you through it. But in terms of numbers, 30. In terms of getting a trend, if you are getting all excellent answers, well, that's fantastic. No doubt you're an excellent osteopath and you are delivering excellent care. But it may be that you've got all those answers that are all, yes, yes, yes. It may be that next time round, or even this time round, you may want to add a few open questions at the end where you can just get that little bit more insight and detail. So hopefully, I think that was that, yes, Samantha, I think that was one of the osteopaths who asked that question. Is that helpful? Fingers crossed. Stacey, any other questions on that front?
That's it for questions. Obviously, there's still time to ask more, so feel free. I'm here in the background.
Thank you for your support, Stacey. And I just want to say to everybody, thank you for your time. Thank you for participating in the polls. And I'm so relieved and pleased that so many of you feel more confident now in terms of analysing your feedback. I know I've said it maybe 10 times here, but myself and Stacey Clift are here to support you. This isn't a research thesis. We aren't going to be looking, if you submit your, if you're asked to submit your peer discussion review form during the verification and assurance process, it won't be us kind of going, 15 patients said they did very well on listening to me. That is not the case at all. We just want you to be able to identify an outcome that you feel confident that you've got feedback on, that you can identify trends. Okay, just checking. Any other questions, Stacey?
No, nothing at all.
Okay, no problem at all. Oh, hold on, I just see something that's popped up. Bear with me. An osteopath has just asked, sorry, I've just popped up on my screen. I'm getting a lot of great answers. I have about 30 responses. Would it be remiss to add new questions? No problem at all. As I've just said, if you want to, so you've done that kind of period of time, you've asked those questions, then in a month's time, if you want to add more questions that perhaps are open questions, no problem at all. It'll be interesting just to compare and contrast. There's no right or there's no wrong, okay? So that's great. Okay, Stacey, no further questions then?
No.
Okay,
no,
that's brilliant. Just to say thank you very much for your time. I'm going to follow up later on this afternoon with an email with all of the slides and with a link to all of the resources that you can download. And it's also got our contact details on it. So thank you for your time. I hope you find it helpful. And if you need me for anything, just drop me a line, okay? All the best, okay? Take care, and I hope everybody has a great afternoon. Bye now. Bye.